Hi, everyone. We are so excited to have you here for the GVHN July webinar on Outbreak Ready. And with us today, we have Simone Parrish, who is the Senior Program Officer at the Johns Hopkins Center for Communication Program, and then Hannah Hamrick, who is a Senior Project Manager, also at the Johns Hopkins, but at the Center for Humanitarian Health. So we'll be hearing from both of them in a little bit, but we just have a few sort of little housekeeping items, and then we'll be turning everything over to Simone. So Renata, I'm going to turn this over to you for the next couple of slides.
Thank you, Carrie. So we're excited to announce that we've started a lot of the planning for our 2022 Global Digital Health Forum. This year, it will be a hybrid event, both virtual in the Asia and East Africa time zones, as well as in person at the Crystal City Gateway in Arlington, Virginia, so near DC. As of last week, we've also opened up for abstracts, so please get those in if you're interested in participating. The submission deadline is August 21st at midnight. For more information, you can go to the link below. It's a DRIFTA website like we've done in previous years. You will have to create an account to then submit an abstract. And if you're interested in having more information, continuing to get updates on webinars, forums, and connecting within the network, please do sign up to be part of the Global Digital Health Network, and the link is included here. Thank you.
Fantastic. Now we are going to turn things over to Simone and to Hannah, and they are going to share all about their exciting program, Outbreak Ready. So Simone, I'll turn this over to you.
Thank you. Thanks, Carrie. Thanks, Renata. Hi, everybody. I'm Simone Parrish. I'll be your moderator for today's conversation. Good evening, good afternoon, good morning to everyone, wherever you are. We'll have a question and answer period after the main presentation today. So if questions occur to you during the presentation, please put them either in the chat or in the Q&A function. For those of you who might not know me, I've been with the Johns Hopkins Center for Communication Programs since August of 2011, and I've served on the Global Digital Health Network's Advisory Council since November 2020. In December 2018, I took on the role of Knowledge Management Lead for READY, which is an initiative funded by USAID's Bureau for Humanitarian Assistance that works to strengthen non-governmental organizations' capacity to respond to outbreaks. I'll put a link to READY's website in the chat in just a minute. READY is implemented by a consortium led by Save the Children, and including the Johns Hopkins Center for Humanitarian Health, where Hannah works, the Johns Hopkins Center for Communication Programs, where I work, UK Med, and the Humanitarian Leadership Academy. Our speaker, Hannah Hamrick, works on READY as part of her role as a senior project manager at the Center for Humanitarian Health. She's the activity lead and project manager for Outbreak Ready, which is an award-winning digital simulation that builds participants' knowledge and skills related to outbreak readiness. And that's the subject of today's conversation. Hannah holds a master's in science degree in migration, mobility, and development from SOAS at the University of London. She has extensive experience in the management of multi-sectoral programming and operations in complex humanitarian emergencies. Her fieldwork has been primarily in the Middle East, Sub-Saharan Africa, and the Caribbean, with a focus on health, food security, WASH, and shelter programming. And she brought all of that international and multi-sectoral experience to her work on the simulation. So Hannah, thank you so much for being with us today to talk about Outbreak Ready's development process. And over to you.
Thanks very much, Simone, for having me. Let me go ahead and share my screen. Here we go. Okay. I am happy to be with you all today and really excited to introduce you to the digital simulation Outbreak Ready. I will talk through some of the process of how it was developed and focusing on some of the key areas of learning for our team throughout this process. So I'll start first with what is Outbreak Ready. So Outbreak Ready is a capacity building simulation that uses gaming technology as the tool. So it's structured as a branching narrative game. So as the learner is moving through the narrative, they're making choices that affect how the events in the story unfold, the feedback that they're receiving from other characters in the game, and also an individualized report that they receive at the end of the game that gives them feedback on their performance. So the overall scenario depicts an outbreak within a humanitarian setting and focuses both on the readiness and response elements for a major disease outbreak. And the learner in the story takes the perspective of the team lead of a multi-sectoral NGO that we called READY. So throughout the simulation, the learner is engaging in strategic decision-making and trade-offs that determine how the NGO prepares for and then adapts and expands their programming in response to the outbreak. It takes approximately 2.5 hours to play, and the purpose is really to be a professional development tool for individual humanitarian practitioners. It's also optional for NGOs to facilitate group learning for their teams as well. So before moving on any further in the overview, I think it would be helpful to show you the introductory video that's included at the beginning of the simulation. And this video really just provides learners with the necessary context they need to begin playing. So I'll go ahead and play that for you now.
This land is a low-income country with a population of 18 million. Despite its human and natural resources, the country struggles with many challenges, including a lack of infrastructure, economic hardship, and weak governance, all of which inhibit development efforts. 13 months ago, disputed elections led to conflict and the internal displacement of 280,000 of this land's people. Although violence has declined sharply since the formation of a new government 5 months ago, the country's situation remains volatile. Responding to the displacement, READY established an NGO sub-office in the city of Murel in the northeast of the country. READY operates programs in 3 informal IDP settlements and within the urban area of Murel, with a focus on primary healthcare, nutrition, food and livelihoods assistance, and clean water and sanitation. You have been team lead for the emergency response for a few months, and together with the READY team and national partners, you have been working to provide critical support to thousands of displaced families and members of the host community. Today starts like any other day at the office, but the life of a team lead never goes as planned.
Okay, I hope that's piqued your interest, and all of you are going to go to the website and play the simulation immediately following this presentation. But just to give you a little bit of background on why Outbreak READY was developed. So it was originally intended to be an in-person simulation, but due to COVID-19, transitioned online, both to respond to the necessary public health measures that were put in place, but also to allow READY the opportunity to utilize an innovative pedagogical tool. So one key thing to mention about Outbreak READY is that at its core, it is not a game. The focus we had was not on the gamification of the content. So for example, you cannot win or lose the simulation. Outbreak READY really focuses on the learning experience for the player, and it includes everything that you would see in an in-person simulation. So multiple characters and scenes, time pressure, stress, decision-making with really limited information and forcing the player to make challenging trade-offs. So our primary aim was for this to be a robust learning opportunity for players and to allow them to make decisions, potentially the wrong ones, in a safe environment. So when we began this process, the key features that we wanted to include we wanted to have a branching narrative game with multiple characters. We wanted the simulation to be suitable for low bandwidth contexts. So it could be utilized by teams working within humanitarian settings at both the national and subnational levels. We wanted a player to be able to save progress so that they had the opportunity to pause play and come back at a later time. We really wanted the feedback report to be individualized and to help support a player understanding the impact of their choices that they made within the simulation and why that is. And then finally, we wanted the sim to be hosted on a website that was available, open for anyone, to allow the training to reach a broader global audience, and also for sustainability after the life of the READY initiative. So this simulation will continue to be a resource that is open and available. And we ultimately decided to host the simulation on Amazon Web Services to that end. So I will share now who Outbreak Ready is primarily designed for. So it's designed for national and international NGOs responding to humanitarian emergencies, not necessarily in the health sector, but with the intention or plans to respond in the health sector. And we're particularly targeting NGO leaders and managers from both operational and programmatic backgrounds across all sectors. So while it is designed primarily to support NGOs, it is also relevant for public health and humanitarian students. We've had a lot of universities contact us that are starting to use it in their humanitarian curriculum. And it's also relevant for humanitarian adjacent professionals as well. So I'll jump a bit into the process and how Outbreak Ready was developed. So we started the process in January of 2021, and this was the initial scoping and the procurement to find the vendor who would develop the digital product. And then we began building the actual simulation in April of 2021. So it took us 1 full year to build a product. I will say that we did push the simulation live on the website in December of 2021 to do some additional piloting and to test the facilitation manuals as well. So we did a 3-month piloting session where we tested with end users, made additional revisions, and then the final launch was in March of 2022. So one thing I will highlight here is that this was a very fast timeline. That was one of our key learning areas, is that it would have been helpful to have much longer, particularly for the narrative development, but we were up against the deadline of the end of our first round of grant funding. So we pushed it out by the end of that date. We worked with a development company in the Netherlands called Range, and just to highlight them because they did an absolutely excellent job. They were a pleasure to work with and really helped us to understand the language of serious gaming, and they did a great job of learning the humanitarian sector and getting up to speed very quickly on what it was that we were wanting to do with the simulation. So there are really 2 primary lines of effort in the development of this type of product. The first is the development of the digital product, which was led by Range. And then in parallel, you also have the development of the narrative content, which was led by our Ready team. And I'll give a bit more details of what's happening in each of these areas during the process. So I'll quickly say, don't look at the writing on this slide. It's not very clear, but I've included it really just to demonstrate what an iterative process this development is. So you can see in the green, blue, and yellow, that's the development of the content, the digital product, and the user testing. And it's all happening in an iterative process where you're developing the content, the developer is building the actual game construct, and then you're conducting user testing. And you do that in a repeated cycle throughout. And I will say that the developer did build more versions of the prototype that is shown in this initial outline. This was the initial plan, which as always changes a bit, but they were continually making small tweaks in response to just additional feedback and revisions that we were requesting. And I think this slide is just helpful to demonstrate the many interdependencies that are happening all together throughout the process. So really, in starting to work with a development company in what they call Sprint Zero, that is the initial scoping and creative phase, working with a developer. So we started that process with the question of how does a humanitarian team lead, which is our target audience and learner perspective, how in real life do they gather information and make decisions during a response? Who are the key stakeholders that they're engaging with? And where are they even primarily located on a typical day? And this helped us to determine what's called the building blocks for the simulation. And the building blocks are really how the player is receiving information and how they're making decisions. So you can see that we determined that the way that the player would get information is through reading their emails. It's through conversations with colleagues in the office, text messages, transition screen, which is something we added so that when the character is moving from place to place, it provides insights and depiction of just the background setting and what's happening with the outbreak more generally in the outside context. And then also they have files, so they're able to read reports on their computer that they download from their emails. And then for making decisions, the learner is able to have interactive conversations. So those are both one-on-one, those are in group settings at a coordination meeting, for example. They compose emails. They have a multiple choice format where they're able to choose from a multiple choice list. And then also they have interactive chats where they're able to respond to chats that they're receiving. And really a key question that we asked ourselves during this period was what level of abstraction we wanted to have and how we depicted the different elements of daily work life. So, for example, a team lead is certainly making decisions about budgeting and allocating budget to different types of activities. But the question we had to ask ourselves is how granularly do we need to present a team lead's interaction with the budget in order to meet our focused learning objectives? And I will say that that is one of just the biggest challenges in the overall development is the question of what to leave out. So our goal really was to depict the role of the team lead with a high degree of fidelity to real life. But obviously there's a limit in what you can include in what was originally intended to be a 90-minute simulation, but quickly grew to 2.5 hours. So that was one of our just primary challenges was the hard task of what to exclude from the simulation. Then after working through that process, we really zoomed out of the detailed interface to consider the higher level structure of what's called the game loop. So that's the pattern of activity that the player is doing. We determined that we would have 2 modules, a readiness and response module with a total of 7 turns. So in each turn, the player is briefed at the outset. They then receive information and make decisions, some smaller, some larger, and then they have the outcome of what happens in the story, and then a time jump to the next turn. And I actually included this earlier version of our initial scoping of the turn structure because we were initially going to include 4 and 5, which is reflection and feedback out of the story. But as we worked through the process, we decided we really wanted to keep this very similar to a humanitarian in-person simulation where you keep the learner in character throughout. That was a decision that we made. I will say it's also one of our lessons learned because we realized that when a player plays, now we're aware that when they play a full 2.5 hour simulation and they receive the feedback report only at the end, it's difficult for them to recall all of the specific decisions they made that amounted to that feedback that they're then reading at the end. So that's one of our takeaways from the process is that next time we will sacrifice a bit of the realism to give players additional feedback while they're continuing to play the simulation. So the second primary line of effort that I referenced earlier was narrative development. Again, this was led by our internal Ready team. There was a steep learning curve for all of us that had never developed this type of narrative before. But we started with what's called a design brief, where we outlined the learning objectives, the target audience, the point of view of the character, and then we began really diving into the characteristics of the world that we were creating. So what is the existing humanitarian situation in the country of this land? What is the history of the country, the history of the conflict that's caused the humanitarian situation? And one priority we had in this area was to not depict a specific country or region because we wanted it to be applicable across kind of all humanitarian response contexts. So we tried to leave that piece just very, very vague so that it could really represent anywhere. We then shifted in building out the narrative overview. So this was linked to the 7 turn structures. So we used a mural, a massive mural, to outline a summary of all the events that were unfolding by turn. So we had the progression of time, then we moved into, okay, the overview of what's happening in the conflict in each turn. How is the outbreak progressing in each turn? What's the government's response? What's the overall NGO response? How are health facilities coping? The community's response to the outbreak. So it was really a very creative and interesting and challenging project of building this full world that would serve as the backdrop for the actual decisions the player was making. So then we moved into mapping the player decisions in each turn. What would be a team lead's priority decisions that they're needing to take at each of these different stages? And then from there, what are the actual options that we're going to present to the player? And what are the consequences of the different options that they were selecting? And an interesting part of this was identifying what's called the golden pathway. So identifying really what are the right choices based on the context and the information that you're giving the player up to that point. And then once you know the thread of all of the right choices through the simulation, then it helps you to develop and to thread in all of the wrong choices that you're going to give the player and the consequences that you're going to present for those decisions as well. So we then moved into what's called ghosting content, and that was building a summary of the narrative mapped by the building blocks. So for example, you say at the very beginning of turn 1, the player is going to receive an email, and that email is going to tell the player that there will be an outbreak and that there's an outbreak in a neighboring country and that they need to be aware of the potential of an outbreak in their country. And that full ghosted content was used to create the first prototype that allowed us to begin testing the simulation with end users. So from there, we moved into building the modules. So drafting and a very lengthy review period for modules 1 and 2, and then a final review and revision for all of the content. A key to all of this as well, and the biggest challenge was linking in all of the many stakeholders that supported the development of the narrative. So to give you a brief overview of that, we consulted with over 100 interagency subject matter experts throughout the development process. We worked with a core team who were the primary authors responsible for drafting content. And then we had 30 interagencies SMEs for sectoral specific inputs, and that included health, nutrition, WASH, food security and livelihoods, risk communication and community engagement, protection, EPI. So what we would do is we consulted with these individuals in advance of writing, then our small team would draft content, and then the SMEs would review and revise. I would say that a really key learning piece we had here is that initially we attempted to have SMEs draft actual content, but it was really challenging to have them write on their specific sectoral or subject matter in this overall world that they hadn't been involved in creating. So we realized very quickly with our poor RCCE expert who was very patient with us, we realized very quickly with her that the best thing to do would be for the core team to draft and then to allow the other SMEs to consult and to review. And finally, I'll just touch here on that fact that we did user testing with over 75 people from different organizations and backgrounds. Many were humanitarian professionals, so end users, but also many were outside of the humanitarian sector. So we consulted with serious gaming experts. I presented the sim to professional war gamers and got a lot of really interesting feedback from that group. And we did that through multiple stages during the process, and all of their feedback really helped us to refine and validate the product and the content along the way. So we also developed facilitation manuals for Outbreak Ready. So we created these to help individuals and organizations really make the most of the simulation. So first, we have 2 manuals for group facilitation, one for in-person events and one for virtual events. So each manual really contains just guidance on how to facilitate, for the virtual, how to facilitate a web-based simulation. It provides estimated timings for play and guidance on how to lead the player through. It also gives the facilitator questions for group discussion. And then finally, it provides a decision matrix that gives an overview of all the key decisions within the simulation and which answers were considered optimal, suboptimal, and bad, and where the key information was found so that the player should have known what was the optimal decision, as well as the rationale behind what decisions were correct. And then additionally, for individual play, we have a solo guide with reflection questions just to guide the player through the key learning moments in the simulation. And I'm happy to say that all of these resources are available in English, French, and Spanish. And they're available for open use on the Ready website, which I know Simone was going to share in the chat. So I will pause there and I will shift into giving a brief demo of the simulation so that you are able to see it. Give me just one moment while I share my screen. Okay, Simone, can you see that okay? Okay, great. All right, so now that you're more familiar with the overall development process, we'll just do a brief demo. You can see here again that you are able to play the simulation in English, Spanish, and French. So we will play in English for now. And again, it's developed for low bandwidth context, so this should load fairly quickly. The only challenge being if you are in a low bandwidth context in a large group of people, it can take a bit longer to load, as I discovered when facilitating this recently. So again, you're able to restart or continue. So I will restart my existing game. You have that introductory video, which I already played. So we have the option to skip it. And then we move into the initial briefing that really just situates the player in the time period and in what's happening in the current situation. So there's one of these briefings at the beginning of each turn. As you can see here, there's not been significant violence in the surrounding area recently. There's still internally displaced people in both the city and informal settlements, some ongoing insecurity throughout the country. And for the player, it's another day in the office with a relatively light schedule. So moving into the actual interface, this is the initial overview of how to play. It just provides some how-to information that's accessible throughout play. The learner can go back to consult this. And then here, it's an overview of the different pieces on your workspace. So jumping in to the team lead's office in the NGO Ready. You have here your agenda. So this gives the learner an overview of what they are expected to do today. So they have time to work on their to-do list in between two meetings, one with the health program manager and one with their national NGO partner, This Land Relief. And at the beginning of the simulation, we've built in additional time so that the learner has time to go into their files. And you can hear that. That is receiving a text message and emails, which as you move through the simulation, that increases tenfold, really to up the pace and the stressors. And at one point, I played through the simulation and didn't read any of my text messages, and I had over 90 text messages by the end. So you do have the feature that allows you to mute because it gets loud throughout play. So we did add that mute button after a user tester really emphasized the importance of it. So you can see here in the files, as I was saying, we really wanted to give the player a rich background of both the country and context, as well as the NGO that they're working with, Ready. So you can see that we have background on This Land. So you have a map that is showing the country, the Ready sub office where the player is located. And some of these things were touched on in the briefing video. You also have a lot of details about the country of this land, so the population, the economic situation, the history of the current conflict, et cetera. And then you have your overall humanitarian response strategy. So what is the current humanitarian response in this land? And then for information on READY, your organization, you have an organization chart with pictures of the characters. You can see here that we have 2 minutes until we'll be meeting with the health program manager. And then you have the READY humanitarian portfolio, which gives you just a more detailed overview of READY. And then it outlines with a lot of detail the different sectors that you're working in, the number of program participants, where your programs are primarily located, who your partners are. So it goes into a lot of detail, which I will admit was a really fun, creative process for all of us. So I will jump to a text message that you have. So this is from Cecile, the country director of READY in Neighborland, which is the country just to the west of this land. So she's telling you that she heard some reports of a possible outbreak of an influenza-like illness in a region in her country. She's let the country director know, but she just wants you to be aware, and she'll keep you informed if she's heard anything else. And then we'll jump here to our emails, where we have an email from your country director, Afreen, and she is forwarding you an email from Cecile that she received and was just referenced. And she's saying, please reach out to colleagues in the Ministry of Health, in the Ministry of Health to find out more information about this possible outbreak. So quickly, before we get pushed into the meeting, I want to just show you the coffee corner. So we built this in, and it's a place where you can hear just informal snippets of conversation being had by different members of staff. This shifts in every turn, and we really just wanted to emphasize the importance of a team leader being accessible to staff and just having chats informally with their team members. So this changes throughout play, and it is, as the outbreak progresses, it's a place where we put in little nuggets of information that actually is important for the team lead to be aware of. And the final thing on the interface here is you have your to-do list, which right now, again, it's empty because we wanted to give the player a lot of time to read that background information. We give a hint to go to the coffee corner once in a while. But as tasks come up, they will present in the to-do list. And then as the learner does them, they tick off throughout play. So the last piece I'll show you is just an interactive dialogue. These are both one-to-one and then had with larger groups in coordination meetings throughout. So this is Naya, your READY Health and Nutrition Program Manager. So she wants to know if we saw the email from Afreen. We did. And she's saying this is something we need to watch closely. She's asking if we know about the Ministry of Health's position and how they're planning to respond. We haven't heard anything, so I'll say that we'll send Sonia, the Ministry of Health representative, an email. And then she asked us to ask for the MOH's National Response Plan, which we do in that email, and then it appears in your file folder for review later. She's asking about whether or not she can send the health program officer because she's busy to the coordination meeting. We'll say that's fine, which is ironically actually the wrong choice, even though we always want to be encouraging building staff capacity. In this case, we put it as the optimal choice that Naya would actually go with the health program officer because of the potential outbreak and just wanting to make sure that they're collecting all of the necessary information. So the player receives feedback later on why that wasn't the best choice in this context. So then finally, she's asking if we've reviewed the readiness plan, the internal readiness plan for the organization. We did not get to that in the file folder. So I will say, actually, I'll lie and say I reviewed it briefly, but I want you to review before it goes out, before circulating to the staff. And so then Naya is going to circulate the plan, and we move forwards there back into the interface. So you can see that you have additional chats coming in. You have emails. So I'll just show you this piece before I wrap this up. Now that you are supposed to email the Ministry of Health, you have this email composed. In some instances, the email is composed for you. In most instances, you have an introductory portion that's composed, and then the player is selecting from a list of options how and what they want to communicate to the recipient of the email. So you send Sonia the email, and you have checked off, and the next task that we need to do is to review the readiness plan and to update it accordingly. But I will pause there because I hope everyone is motivated to play the simulation themselves. So I don't want to give too much away. Just to add, before handing back over to Simone, is that we are currently in the process of doing this complete simulation development all over again. So we are building right now Outbreak Ready 2. That's a working title. But we are developing a second simulation that will exist within this world of this land and within the NGO of Ready, but it will be a different user interface, a much different player experience, because we will be targeting health program managers, and the purpose is really to teach the more health technical components of an outbreak response. And the simulation will also have a strong focus on risk communication and community engagement. So this initial simulation really provides a more generalist overview from the health team leader, or from the team lead perspective, of all the different decisions and priorities that a team leader would have to make. And then in the next sim, we'll zoom in on the decisions a health program manager is making, and really the decisions that are happening on a clinical level during an outbreak response. So with that, I will pause there and hand back over to Simone. So thank you so much.
Hannah, thank you so much. I know how many levels you managed during this process, from the tiny details to the overall project structure, and you've done such a great job. I really appreciate you walking us through this process today. Thanks. I have some questions to kick us off with. I'm not seeing a ton of questions in chat yet, so participants, please add your questions there if you have them. But going into any kind of development process, especially when you're trying to build something this complex, Hannah, there are some challenges that you might have expected would crop up. Like when you make your initial plan, it's almost certain that some of those things are going to change. So if something changes, that's not a big surprise. But what were some of the challenges that you encountered that were surprises to you?
I think a primary one was really when we started working with the developer, was just understanding the ways of working and the vocabulary that a digital development firm who specializes in serious games that they use. So we found that there were just many terms and even approaches to project management that were entirely different from the humanitarian sector. And so for all of the Ready team, which was comprised all of humanitarian professionals with one consultant who is a serious gaming expert who really helped to lead us through the process. We found that he had to do a lot of translation just to help us understand the language that the company was using. I'd say another thing that was really challenging is we initially had just such a limited understanding of what was possible. So we originally intended to have multiple endings, and we imagined that the individual player was making choices that really just affected kind of every aspect. So it's what's called conditionality. So we thought there would be so much conditionality, so much complexity, but we quickly realized if you start branching the narrative early, and it continues to build, then throughout narrative, you're really working on completely separate projects, because the scenario has to be incredibly different if the learner is able to direct play in a really tailored way. So that was a realization that we had of just the fact that you have to limit conditionality, or else you'll write entire narrative sequences that very few players would actually see.
Right. Right. It's like those choose your own adventure books. I don't know if those are still a thing, but when I was a kid, they would be like, I don't know, 100 pages long, because there are only so many scenarios that you could go through, because you're
absolutely
a little paperback. You're not trying to build like a total encyclopedia, right? Another question that I have is what is the one most important thing that you will do differently next time?
Well, I mentioned briefly the development timeline, and I think that for us was the key thing that we are doing differently. So the last simulation, once we started with the developer and with the narrative development, we had 35 weeks, which was just much too fast. And this time we've moved to having 50 weeks for development. And I think really that the purpose for having additional time relates to the narrative development. We realized we should have started that earlier, far in advance of designing the actual simulation, because even though you can't start drafting the content specific to those different building blocks, like is it an email that you're writing or an interactive dialogue, for example, you can't start actually drafting and scripting that content, but you can have a clear idea of the overall narrative progression, the main decisions you're wanting to include, and most importantly, how those link to the learning objectives and skills. So I think in hindsight, we would have started that process outside of working with the developer much earlier.
I see Lisa Moinkamba is one of our participants, and I was wondering, I'm going to put Lisa on the spot if she's available, to on the topic of working with subject matter experts, there's Lisa in chat, working with subject matter experts, and at what point during the development of a learning experience it's appropriate to bring a subject matter expert in, like having them actually compose pieces of a narrative or sections of an online course versus having your outline all built out and then going to them and saying, okay, we need these pieces of information from you. I was wondering if other people online had similar experiences or different ones from Hannah's.
Hi, Simone and Hannah. This has been awesome. I guess my experience has been, I think the comment from the very beginning is like, especially subject matter experts are so excited about the topic as a whole. So to synthesize down, it really is important to typically have their buy-in early on so they understand the format or delivery, that what is essential versus good to know.
Right.
And so, yes, they might not be involved in the development of the content upfront, but maybe making sure that they have a sense of even if it hasn't been developed already, are there examples of kind of the extent to which you can dive in? And so we have found it, at least with like, say, developing global health e-learning courses, even though there's plenty of courses around, that sometimes engaging them just for review and sending it out, like we kind of had, it was better to have at least prep meetings so that they knew that like the difference between essential and good to know.
Thanks so much, Lisa. That's really useful. There's another question posted in chat from Marla Shaditz, who asks, Hannah, can you talk about building for sustainability as it applies to online games? Can a tool like this live post-project? And that's such an important question right now, because I think we've all seen this huge body of resources that were developed around and specifically for COVID-19, and that as funding for COVID-19 is dwindling, some of those resources are just disappearing. And one of the things I really appreciated about Outbreak Ready was the plan that we have made for that going forward. So can you talk about that a little bit?
Yeah, absolutely, Simone. This was a really high priority that we had. And so in reality, when Ready was going to facilitate these as in-person simulations, obviously the development of that curriculum and then the presentation would be fully linked to the time period of the Ready grant. And so in shifting online, that was kind of a key motivation for making that shift. And we had an agreement, we have an agreement that exists that Johns Hopkins will be responsible to pay just the very minimal hosting costs on the Amazon site. or Amazon Web Services in order to host the simulation, ongoing. And even if, depending what happens also with the Ready website, we will shift to having the simulation available on CHH and on Hopkins, because we really, with the resources and the time that are put into building these types of schools, if there isn't a plan for it extending past the grant date, then it really is lacking in kind of the thought that goes into it. So
that's one of my personal digital soapboxes. Is I think a lot of people have this concept that once something is on the internet, it stays on the internet forever. And that can be true in some senses, but really, if something's going to remain available to the public, that means someone somewhere is paying a bill. And because of the way USAID funded projects in particular work, if you don't have a funding mechanism to pay for something going forward, it's very, very difficult to keep things online. So I loved that we had that plan from the get-go of, yes, this is a Ready initiative product, but once the Ready initiative ends, we have a home for this to go to. Thanks. Oh, and you mentioned Amazon Web Services. Can you talk just a tiny bit more about the platform decisions of how we chose that? Or is that all in?
That was primarily Ayn Rand. They prefer to use Amazon. And so when they presented us with the different options, they were strongly recommending that. I mean, a key consideration was costing as well. It's really cost effective, and it was therefore really simple for Hopkins to agree to take that on to host it in the longer term.
Thanks. I'm just looking through chat to see if we have any more questions here.
I'll jump in just to say I really like Lisa's comment about focusing on learning objectives to make sure that the content fits in there. And I will say that was much more challenging than I imagined, because you have all of these creative minds and all of the different sectoral SMEs speaking in, and it was challenging to always bring back to, okay, how does this decision, how do these options we're presenting to player really link to what we're trying to teach? Not that all of it isn't important, but how does it link to what we're trying to teach? And so that's something that we're doing differently in this new development process. Is I've created a much more detailed list of the skills, and as we're adding in ideas to the narrative, I'm asking everyone, which skill does that fit under? And if it doesn't, then do we need to include it? Or if we do need to include it, then we need to add a skill. So really just helping to hold us accountable to what we've said we want to teach based on the gaps that we see. But it's really difficult because everyone gets excited and we want to include as much as we can. I mean, I'm guilty of it. Again, a 90-minute sem into 2.5 hours. So guilty.
I'm not seeing any more questions in the chat. But I would like to give, if there's anybody else who has another question, please, in the next couple of minutes, if you could post that would be great. Otherwise, I would just like to thank Hannah so much for being here with us today. I'd like to thank everybody who joined us on this call. I know that the Global Digital Health Network sends the recording link for these meetings out to the whole network. So we'll get more views of this meeting down the line a little bit. And it looks like that might be it for this morning. We can give each other the gift of a little bit of time back. Carrie, do you have any wrap-up thoughts or any other business?
Thanks, Simone. I can do just a quick closeout. Wanted to thank you and Hannah again for such a great presentation and moderating this. Thank you everyone who has joined and participated in today's webinar. As Simone mentioned, we do record these. It will be available on our YouTube page. And we will share the slides as well. So thank you, everyone. Have a great rest of your day.
Yes, thank you so much. This was really fun. And Hannah, I just want to say a big shout out for being brave enough to do a live demo. That is always, it can be a wild card, but it was amazing. And I will say that every time that the message that buzz beeped, I did look at my phone. Like I just had that moment where going, oh my gosh, my phone's ringing or beeping or something. So really applaud the attention to detail. It was really exciting. And even just in that short demo really gave us a sense of both the reality and I think really the urgency of a potential outbreak situation. So very, very cool. Thank you so much. Really appreciate it.
Thanks so much for having me, Carrie. It was a pleasure.
Thanks, everyone, and we hope you have a great rest of your day, and we look forward to seeing you at the next GDH webinar in August. Thanks, everyone. Thanks again, Hannah and Simone.